Okay, so if you're in the UK and you suspect or have small fiber neuropathy, but you don't know the cause yet, your cause is likely to be immune related. A large percentage of idiopathic causes are immune related. You just might have rarer markers, biomarkers that it's like finding a needle in a haystack to try and find any biomarkers to prove this. And obviously, you need to prove it in order to access immune therapies to help you get treatment in order to be okay. So it is quite helpful, obviously, and important to get more information on this if you can. There is a laboratory in Sweden that does extensive testing for this. You might be able to persuade your neurologist in the UK to get some of these tests done in like a research lab, but honestly, it's pretty inaccessible. And the main ones I think I have, they just don't do them. So I had to send it abroad. Anyway, here is WISLab offers a new small fiber neuropathy panel for extended testing. So that's the lab in Sweden. It's proud to be one of the first diagnostic laboratories in Scandinavia to offer an extended panel for small fiber neuropathy testing in serum. In close collaboration, blah, blah, blah. We have developed extended panel, blah, blah, blah. It talks about some autoimmune diseases that are often associated with SFN. However, the cause can often be unclear for a lot of people, which causes significant problems for a lot of us, obviously, because we need to know what's causing it in order to treat it. Small fiber neuropathy can overlap with other muscle pain syndromes and can be found in fibromyalgia. It's often misdiagnosed as fibromyalgia. So if you have a diagnosis of fibro, especially in the UK, you may well have SFN instead or in addition. Basically, it's not treated here, and therefore they kind of ignore it, in my experience. Tell you it's in your head or tell you it's fibro. So obviously you want to know what you have so that you can treat it accordingly or try and get it treatment. And anyway, we need to do campaigning to get appropriate treatment in this country. I do have a link in my bio for you to send an email to your MP and counsellor about that if you want. Anyway, associated with muscle cramps and complex regional pain syndrome, SFN has been reported in up to 40% of patients with fibromyalgia. Treatment of SFN is based on the primary cause. That's what I was talking about. Determining the underlying cause in SFN is important, basically. So the new extended panel includes novel inflammatory autoantibody markers. So lots of these are more common if you have hypermobility, especially if you have hypermobility EDS. You are more likely to have the autoantibodies TS, HDS, Plexin D1, and FGFR3, which also respond well to immunotherapies and IVIG, etc. So obviously it's a bit hit and miss anyway, but yes, this is again why it's important for us to get the treatments and the information. So they do a panel to look for all of these. So TSHDS are reported as a subgroup of patients with small fiber neuropathy of unknown underlying cause. The onset of SFN associated with TSHDS antibodies may be subacute. Plexin D1 antibodies have been detected in patients with burning pain and thermal hyperglacia. The symptoms often respond to immunotherapies. SSA-RO60 antibodies are markers for Sjogren's syndrome and systemic lupus erythematosus, but can also be seen in other systemic diseases. SSBLA antibodies occur almost always in conjunction with anti-SSA and are frequently found in primary Sjogren's syndrome and systematic lupus erythematosus. Transglutaminase AGA-TG2 is a strong diagnostic marker for celiac disease. SFN and sensory disturbances can precede the diagnostic of celiac disease. CV2CRMP5 antibodies are pyroplastic submarkers primarily associated with small cell lung cancer, but may also associated with other types of tumors. Let's see. Clinical symptoms may be related to neuropathy. And PCA2 antibodies, the Pituitary antigen, I can't say most of this stuff. 2 antibodies are primarily associated with cancer in breast, ovary, and lung. And our typical SFN has also been reported with these antibodies, but it seems to be rarer. Fibroblast growth factor receptor 3 have been reported in patients with autoimmune diseases and concomitant sensory neuropathy. CASPR2 antibodies contactin and associated protein 2, CASPR2, is an extracellular antigen and a subunit of the potassium channel complex VGKC. Antibodies against CASPR2 have been reported in patients with SFN and autoimmune. I don't know what the rest of that says, but you get the point. So yeah, feel very privileged and chuffed that we have got the bloods to be sent off to do that. Very, very happy. There's an immunology center called the Allergy and Immunology Clinic and Centre in London. They very kindly offered to do this for me. I did have to pay quite a lot of money to do it. They also didn't really have to do it, so it was really nice of them to have done it, but obviously it cost a lot anyway. But yeah, it's just something you should be aware of if you're thinking about this as well. Because most neurologists, private or public, won't do these tests. They wouldn't have the tools, but it's also very hard to get them to do anything. So, yeah, if you're desperate and you have the funds or can raise the funds or can somehow get them, then I would recommend having a look at this. I'll give you the details of the clinic as well. Yeah, so these are the guys that agreed to do it for me, and they didn't have to, and I'm very chuffed that they did and helped me. Oh, why is this off? This should be on. There's no. What's the point? I hope that some of that recorded. Okay, well, my microphone's just been off for ages, so apologies. But yeah, these are the folks that took the bloods today and sent them off to Sweden to get my results. So yeah, I would highly recommend if you can and need this. So yeah, lots of love.